I'm getting a pancreatic headache because my cells are swimming and dancing in sugar. And this woman keeps pumping us with more sugar, so we have to get it out of her bloodstream. Your pancreas releases even more insulin and forces your glucose receptors to store more of it as fat. Your glucose receptors get even more resistant and refuse to store any more as fat, so your pancreas releases more insulin. The more sugar in your bloodstream, the more your pancreas releases insulin and the more resistant your receptors become. High levels of insulin get released on a continual basis called hyperinsulinism. High levels of insulin in your body results in the disruption into the cells, enlargement of your pancreas, inflammation, and it creates a landslide of destruction to the various systems in your body, especially your liver, and exposes you to the condition of preeclampsia. Eventually, your body stops responding to insulin. Your pancreas either gets too worn out to continue its work, or it gets damaged by the high levels of insulin and can no longer release insulin. This is when blood sugar levels remain high and type 2 diabetes begins. Most screening tests are based upon taking blood investigations, dietary advice, and exercise. But dietary advice can be very confusing. You need to learn about insulin resistance and how it affects you and your baby. And then you can teach this to your growing child to prevent your child developing diabetes. You might want a referral to a complementary therapy specialist who can help you with dietary advice, coping skills for stress, and homeopathy is a great supportive option. Insulin resistance often occurs at the same time as leptin resistance. Leptin is a hormone in our fat cells that tells us when we're full after eating food. When leptin resistance develops, your hunger cravings don't turn off. It leads to overeating and cravings for sugar and carbohydrates. Obesity occurs. High triglycerides build the adipose fat tissue located just below the skin. Later stage insulin resistance symptoms include autoimmune disorders, polycystic ovary syndrome, infertility, weakened immune system, nutritional deficiencies, kidney disease, blood clots, food allergy and sensitivity, constipation, and many more problems. Stress. If you're continuously under stress, your liver will be constantly releasing sugar into your bloodstream, and your pancreas will be constantly releasing insulin. When you're under stress, your adrenal glands release adrenaline, which tells your liver to dump its glycogen into your bloodstream to deal with the stress at hand. Eventually, your glucose receptors start resisting because it's too much sugar to deal with. So if you're already moving towards insulin resistance because of the wrong diet, then added excess stress will push you down the road faster. Eating a healthy diet does not escape diabetes if you are under a lot of stress. If you don't have resistance yet, the mere existence of excessive stress alone can result in insulin resistance because it triggers the whole cycle as if you've eaten sugar. Acupuncture alone will not help if you are under severe stress or eating unhealthily. Meditation and homeopathy can help you deal with your stress. You may need a combination of complementary therapies. Stress in your pancreas. It's associated with a feeling of being trapped, and resentment and loss of freedom. It's easy to see how you first-time moms can develop insulin resistance to stress. You put your career on hold, freedom and income to take care of your new baby. Your baby is telling you to look deep within and love yourself. Play a little, enjoy yourself, and befriend the small sweet child growing inside of you, and take care of both you and your baby. Environmental toxins. Common everyday chemicals in your environment put excessive stress on your endocrine system. Exposure tells your adrenal glands to get your liver to pump sugar out into your bloodstream the same way as nicotine or caffeine. So reversing insulin resistance. Insulin resistance symptoms can be reversed simply by changing your diet, doing regular exercise, and reducing stress. Experts tell us that insulin resistance and type 2 diabetes can almost be reversed with diet and exercise. Exercise. Brief periods of intense exercise burns glucose off and lowers insulin levels. It helps stabilize your autonomic nervous system. It tells the adrenal glands to stop releasing adrenaline, which triggers your liver to dump glycogen into your bloodstream. But exercise alone will not work because you'd have to exercise continually to burn off all the sugar if you continue to eat the refined carbohydrates. Exercise in combination with the removal of starchy carbohydrates enhances the reversal process. Exercise is necessary if you have a lot of stress in your life. Sleep, breathing, and meditation. Mindfulness and mindfulness meditations are simple and powerful ways to bring blood sugar down because they turn off your stress response system. So you need to reduce stress and get adequate sleep. Practice deep breathing exercises. Your respiratory system is the best tool you have to eliminate toxins. So if you take a deep breath in and you hold it for a short period, and then you have a longer breath out, as you blow out, you're removing the toxins from your body. So you should practice meditation and breathing. And they all help you relax and live in the moment. So what are the tests for gestational diabetes? A Hba1c level at booking, a glucose challenge test at 24 weeks. If positive, a fasting glucose tolerance test. If positive, there'll be a referral to the diabetic team specialist who will plan care with you and your LMC. Hba1c. Hba1c is glycated hemoglobin. The Hba1c develops when hemoglobin, a protein in your red blood cells, joins with glucose in your blood and becomes what they call glycated Hba1c. Measuring your Hba1c gives an idea of what your average blood sugar levels have been over a period of weeks or months. The more sugar you have in your blood, the higher the percentage of glycated hemoglobin, Hba1c. The higher the Hba1c, the higher risk of developing diabetes-related complications. When your body processes sugar, glucose in the bloodstream naturally attaches to hemoglobin. The amount of glucose that combines with this protein is directly proportional to the total amount of sugar that's in your system at that time. Red blood cells in the human body survive for 8 to 12 weeks before renewal. And the Hba1c test would be done at 8 to 12 week intervals. And as you can see here, Hba1c is normal below 42. Pre-diabetes is 42 to 47, and diabetes is 48 or over. Your glucose challenge or polycose test. Only about 1/3 of you women who test positive on the glucose screen actually have the condition. If you test positive on the screening, you'll need to take a fasting glucose tolerance test, a longer, more diagnostic test that tells you for sure whether you have gestational diabetes. And remember, increased stress is known to increase your blood glucose levels. So do not go for diabetic blood tests when you are stressed, as it raises your blood glucose levels. Make sure you have a healthy diet 1 to 2 weeks before doing the test. Your care should be individualized, and you as an informed woman should make the decisions about your care with the right to accept or decline any treatments. The medical treatment for gestational diabetes. If you have gestational diabetes, you'll be referred to the diabetic team or specialist team. You'd be advised dietary and lifestyle advice. They encourage you to monitor your glucose levels pre and post meals. If your blood sugar levels are still high, you may be prescribed an oral medication or metformin or insulin injections. The specialist may recommend induction of labour on or before your due date according to your individual situation and your blood glucose levels. Acupuncture may help you. Acupuncture regulates blood glucose levels in diabetics and improves the performance of metformin, an oral diabetes medication. When electroacupuncture is combined with metformin, it improves glucose lowering performance and the regulation of insulin secretion. In recent studies, researchers stated that a combination of electroacupuncture with insulin sensitizer may be a new treatment for type 2 diabetes, but this has not been researched in pregnancy. So you would need to speak to a Chinese medicine specialist before considering acupuncture. So finally, gestational diabetes and insulin resistance. Avoid getting it. Be wise, eat healthy foods, manage stress and exercise. Thank you. Okay, I'm open to you all asking questions on that and to let me know what you feel about it.
Thank you so much, Irene. Okay, everybody, if you have any question, you can turn on your video, please. Yeah, let us see your beautiful face. And now it is doubt clearing session.
Yeah. I can't see Louise, Anita, or Koala.
Yes. Koala, Louise, Anita, we'd like to see your beautiful face, and please turn on your camera. Thank you. If you have any question, you can write. Yeah, thank you so much, Anita. Hi, nice to see you.
For Louise.
Very good. Thank you so much. Louise, Koala. We like to see you. Thank you, Louise. Thank you, Louise.
Good, great. I got the ceiling of Louise, yeah.
Okay. Turn on your camera. Zahra, لطفاً ویدیوتون روشن کنید. Thank you, Louise. Nice to see you. Wow, lovely.
Okay, so if you've got anything you want to talk to me about that with, just raise your questions or how you feel, or maybe